Hello, welcome to Human Health with another topic. Naegleria virus, and its hidden risks and effects. Naegleria is an infection caused by a brain-eating amoeba, which is commonly found in freshwater lakes, rivers, or hot springs. You can also become infected by it whilst swimming in pools and engaging in other freshwater sports. Please press the bell icon to subscribe to our channel for more information related to health. This amoeba usually travels through the nose and enters the brain where it causes severe damage. The symptoms start to show within 24 hours of contact, and the amoeba can take your life within 7 days. As a preventive measure, chlorine should be poured into your home tanks to kill any such amoeba which may exist in the water. For frequent swimmers, during the summers, it is important that you choose the swimming pools wisely and make sure that the authorities maintain them regularly. Symptoms: once the amoeba enters your brain, it leads to inflammation of the brain tissues and destroys it completely. After contact, the symptoms start to exhibit themselves from around 2 to 15 days, but once they do show, the disease progresses rapidly. This can typically lead to death in a week. The most common early symptoms are headache, fever, nausea, and vomiting. Later symptoms include neck stiffness, lethargy, confusion, disorientation, photophobia, seizures, and cranial nerve abnormalities. Findings on the exam may include meningeal signs and focal neurologic deficits. Signs and symptoms mimic those of bacterial meningitis, especially in the early stages. Rarely, abnormalities in taste or smell, nasal obstruction, and nasal discharge have been observed. PAM progresses rapidly and frequently leads to coma and death in 1 to 18 days, median 5 days, after symptom onset. The infection destroys brain tissue and causes cerebral edema, which is often the cause of death. Autopsy findings include hemorrhagic necrosis of the olfactory bulbs and cerebral cortex. Prevention. To make your water safe for sinus rinsing and ritual nasal rinsing, it is safest to use boiled, sterile, or filtered water. If that is not possible, disinfect the water using chlorine. The cloudiness of the water can affect the ability to disinfect the water. Naegleria fowleri can grow in pipes, hot water heaters, and water systems, including treated public drinking water systems. You cannot get infected from drinking water contaminated with Naegleria. You can only be infected when contaminated water goes up into your nose. Clean noses during religious practices or irrigate their sinuses, nose, using contaminated tap or faucet water. When to see a doctor. Consult the doctors immediately if you see a sudden onset of any of the above symptoms. Especially if water has gone up your nose while swimming, ablution, bathing, or any water activity. You can rapidly consult the 24/7 emergency services and acute care services as well, where the team has been trained to screen Naegleria swiftly and will perform the required test immediately, if need be. Tests and diagnosis. It is usually diagnosed through imaging testing. Computerized tomography, CT, scan. Your brain will be scanned to look for the affected area through cross-sectional images. Magnetic resonance imaging, MRI. The brain is a soft tissue, and MRIs are most effective in detailed imaging to look out for the anomaly caused by the amoeba. Naegleria microscopy and PCR. Spinal tap or lumbar puncture is a test by which fluid from the spine is obtained by inserting a needle between 2 vertebrae in your lower back. After that, suspected Naegleria amoeba can be seen under a microscope in the fluid that surrounds your brain and spinal cord. To confirm that the amoeba are Naegleria, a PCR test is required. Disclaimer: kindly consult your physician before getting the above-mentioned tests. Treatment. Very few people survive Naegleria. However, if this disease is detected early, it is treatable. However, the survival rate remains thin. As primary treatment, prescribed medications will be injected in the vein or in the spinal cord to kill the amoeba. Various support services to help with managing or recovering from disease or condition. These include but are not limited to nutrition, physiotherapy, rehabilitation, specialized clinics, and some patient support groups. Your doctor or nurse will advise you accordingly. Remember, while Naegleria fowleri infections are rare, it's crucial to be aware of the risks associated with warm freshwater environments. By staying informed and taking simple precautions, we can enjoy water-related activities while keeping ourselves and our loved ones safe. Let's spread awareness about Naegleria and the importance of prevention. By sharing this video and educating others, we can help reduce the risk of Naegleria fowleri infections and ensure everyone can enjoy water activities without fear. Thank you for watching and learning about Naegleria fowleri. Subscribe our channel to get more information related to health. By understanding the risks and taking necessary precautions, we can continue to appreciate and enjoy the wonders of water, while keeping ourselves safe from this rare amoeba. Let's dive into a world of knowledge and responsible water activities. By being informed, taking precautions, and spreading awareness, we can make a positive impact and help prevent Naegleria fowleri infections.